are going to switch gear today. We are going to talk about pediatrics. So we are going to leave the COVID-19 aside because that's been beaten to death, is boring people out to death. It is not going anywhere. So we are going to talk about something else that is pretty important but not getting any attention. Although this disease does not kill as many people as the coronavirus, but it is important, especially in the pediatric world. So for those of you with infants or having infants in the family or children, you might want to pay attention to this video. And that disease is called Acute Flaccid Myelitis, AFM. You may have heard about this disease several years ago in 2014, where it made international headlines. It's pretty much confined to the United States. It is a relatively new disease because we've never seen this before. And therefore, ongoing researchers are trying to identify the mechanism to why we have this disease, and we're also trying to identify the treatment for this disease. So, acute flaccid myelitis, AFM. Acute means rapid, fast, rapid, immediate, sudden is acute. Flaccid is a medical term for floppy or paralyzed, but more of floppy. Okay, and myelitis simply means inflammation of the spinal cord. So acute flaccid myelitis, really fast, sudden onset of floppiness caused by the inflammation of the spinal cord. The causes of AFM, we think at this point, is caused by a virus, and that virus is enterovirus. Non-polio type enterovirus, D68 and A71. Those are the two subtypes that are most commonly found. Other viruses have also been identified in the cause of AFM, such as Coxsackie virus, such as West Nile virus, herpes virus, and adenovirus, and some others viruses as well. But the enterovirus D68 and A71 are the two most common viruses identified in the cases of AFM. So what are the presentation of AFM? The important thing to know is that this disease almost exclusively happens in children. In fact, back in 2014 to 2017, they had a total of over 300-400 cases, of which 60% of the patients were male infants or male children, and the median age was 6 years old. Now, the youngest one was 3 months, and the oldest one was 21 years old. So the median age of 6-year-old, it happens, the vast majority of the time were in the age bracket of children. And 90% of these children had some form of a viral infection the 2 weeks prior to the onset of AFM. So they have an upper respiratory infection, and of course, enterovirus D68 and A71 are responsible for the majority of upper respiratory infection. In fact, 10 to 15 million Americans are infected with this virus yearly. I myself probably got infected with this virus at least half a dozen times. It causes sore throat, runny nose, fever. It causes cough. It can lead to bronchitis and pneumonia. It can attack the GI tract and cause abdominal pain and diarrhea. Why does this particular virus cause AFM is the million-dollar question. So there are two hypotheses at this point to why this virus can cause AFM. The first hypothesis is not really holding water, and that is they think the virus may attack the tissue in the spinal cord and causing inflammation in the spinal cord itself, hence the term myelitis. However, this hypothesis is rapidly going outdoor because you can have 4, 5, 6 members of a family infected with this virus, and most of the time nobody has any AFM, but 1 or 2 children might get AFM, and so therefore saying the virus is attacking the spinal cord is unlikely at this point. The second hypothesis, which makes more sense, and that is the autoimmune hypothesis. So basically what the CDC, or the Center of Disease Control, think is that if an infant or a child is infected with enterovirus or the other viruses, but mostly enterovirus, there must be some cross-reactivity between the virus and the tissue of the spinal cord, most likely a protein. So when the immune system is fighting the virus, it becomes so hyperactive, it ends up attacking the tissue of the spinal cord, causing the inflammation in the spinal cord, specifically the gray matter of the spinal cord, sometimes the white matter as well. So the presentation, the clinical presentation of a child getting AFM is that it almost presents like polio. So therefore, another name is a polio-like syndrome. So the child may have flaccid paralysis of the limb, so arm or leg, one side or both sides. They may have facial droops, they may have eye droopiness, they may have paresthesia or loss of sensation on the hands, the arm or the legs, the knees or the ankle. They're not able to walk, they're limping around, they're not able to use the arm. Some child may develop constipation as a result of AFM. And the other symptoms, which are not signs, which are not very obvious, is that it can cause constipation in children. And that would fool a lot of parents because children themselves have quite commonly constipation. Now, if you talk about small babies, okay, we're talking about really infant, the tiny babies, you might see that they may have floppy limbs, meaning that they are unable to maintain the muscle tone. So if you have an infant and you lay them on the bed, usually you're going to see their arms and their legs are flopping in the air. They are flapping in the air, and they are not floppy and hitting the mattress. So an infant that is flaccid will not be able to flap their four limbs in the air. And also, they may not be able to lift the head. So they're going to see they have difficulty lifting the head, and that is an important sign. You can also see drooling, inability to eat, and inability to swallow. You may also see some infant or children might have difficulty urinating. So if your child has any of these most common symptoms, it is very important that you contact your pediatrician and have your child to be evaluated by the pediatrician. However, if your child is having symptoms of flaccid paralysis, floppy infant, for example, difficulty eating, drooling, difficulty lifting the head up, difficulty breathing, then you do not wait for the pediatrician to evaluate your child. You bring your child or your infant directly to the emergency room to be evaluated immediately. So there are a couple of things that doctors do when they see your child. Obviously, a complete physical exam is very important. More importantly is a complete neurological exam, and that you have to be medically trained to examine the neurological system of the patient. And then the doctor would order several tests, such as nasal swab, throat tests, blood tests, and also stool tests to identify the viruses. But more importantly, you need to rule out other diseases such as polio, stroke, tumors in the brain, and also the other viruses, and also meningitis and encephalitis as well. So the workup is important to identify the AFM. However, the treatment is very limited. Until today, there's really no effective treatment that can eliminate or treat AFM. Most of the treatment are supportive. They have tried IVIG, which basically means you pull the antibodies and you inject them into the blood in hope that the antibodies can fight off the virus and kill off the virus. That didn't really work. And in some cases of AFM where severe enough it attacked the diaphragm, where the patient has difficulty breathing, it might be life-threatening and they need to be intubated and remain in ICU. So most of the patients recover from this disease, but there are a large number of patients who recover and suffer from the consequence of the disease, is that they continue to have weakness in the arms or legs, or they may have their droopiness on the face or the eye non-recover or not completely recover. So we know that this disease happens more commonly at the late summer and the beginning of the fall. So it is important that you vaccinate your infant against flu. It is important that you vaccinate your infant against the other childhood diseases, such as polio, such as meningitis. And these vaccines do save lives. And that help to a certain degree prevent these diseases. And what you cannot vaccinate, such as enteroviruses, such as Coxsackie virus, or the other common viruses, then you have to deal with the consequence of a potential having AFM. So this diseases is not really taking attention from people because of the coronavirus. So there are good resources online that you can read, mainly from the Center for Disease Control website and also the Mayo Clinic. You can read about the more in details. Be very careful with other websites. So if you have any questions or concern, it is important that you address them with your pediatrician. And I hope you find this video helpful, and I hope you subscribe so I can see you next time. Stay safe.